I love libraries, which isn't surprising considering that I talk about reading on this channel. I've been going to the public library since I was little, and I was a teen volunteer for a while. And not long after moving to Arlington, I got a library card there too. But most libraries do more than just check out books. They're also voting sites, places for education, and they're increasingly addressing people's health needs. If you don't know me, hi, I'm Nadia. I talk about public health and pop culture, and for day 4 of National Public Health Week, we're talking about community leadership. I'm super excited to be joined today by Heather Johnson, who founded a company focused on bridging the gap between libraries and public health. If you're enjoying this week's videos, be sure to like, comment, and subscribe. And without further ado, let's get started. "17 libraries in Las Vegas, Clark County, Nevada have launched hydroponic garden programs to help people grow healthy food. North and South Carolina have placed social workers in libraries. And libraries are increasingly participating in harm reduction for substance use. These are just some of the ways libraries have been involved in serving community needs and public health. When I learned about Heather's work, I was excited, both because it relates to my interests and also because it addresses the work happening outside of traditional health institutions. And now, here's my conversation with Heather about her career and how we can all support public health and libraries. Yeah. Hi, Heather. Thank you so much for joining me. Can you start out by giving an introduction?
Yeah, I'm happy to be here. So my name is Heather Johnson. Wear a lot of hats in my personal and professional life. I currently work for Exact Sciences, which as of a couple of weeks ago is now the Abbott Cancer Diagnostics Division. And there I am principally charged with systematic review, implementation, and execution. Outside of work, I'm also a DRPH student at Emory, focusing on implementation and evaluation science. And I will most likely be focusing on colorectal cancer, although I feel increasingly drawn to the library because that is where I began my career. I worked in medical libraries and also a public library for a bit. And as I am getting deeper into my studies at Emory, I'm realizing that the library really is part of critical public health infrastructure. So I feel compelled to bridge the two Heathers and connect those two worlds.
Yeah, of course. I definitely know what it's like to bridge two different worlds in terms of my interests. And you kind of started touching on this, but can you talk a little bit more about your work, sort of connecting libraries with the work that goes on in public health?
Yeah, so this is a somewhat recent endeavor for me. Well, I guess I shouldn't say that. So, when I was in library school, I basically had an interest in public health, but I did not have the money to pursue an MPH or move. I was working at the University of Rhode Island, and one of the benefits of working there was that you could get a very low cost master's degree. And my creative mind said, I will get a master's degree in library science and use it to immerse myself in public health. So, although what I'm doing very actively is a somewhat new endeavor, the bug has always been there. When I was in library school and out of library school, initially I was implementing public health programming and I realized I did it all wrong. I started with an interest and then implemented my program and had very simple surveys, but that's not the right way to do it. You know, if you're a public health person, which you are, you know the right way to implement a program so that it's grounded in evidence and is most likely to have the greatest impact. And I realized, particularly through my coursework at Emory, that there's a real opportunity to connect with other librarians who might be in the same mindset that I was. I have a great idea. It's novel, it's new. I think there's a need. Let's go ahead and do it. But I can jump in and say, yes. And also, let's make sure that there's a need and let's make sure that we're connecting with the right public health professionals because they have different experience and context, and also public health people, let's bring in librarians as much as possible because they are part of critical public health infrastructure. They're interacting with some of the hardest to reach people every single day. And I think what happens far too often is libraries are brought in at the implementation stage rather than at the beginning. And I think there's a really important opportunity to connect those two worlds as early as possible and to give librarians, especially, the tools to help make those connections. And if they don't have access to a public health professional, they can start implementing programs through a public health lens.
Yeah, that's really great. And of course, I'm familiar with the work that some public libraries do around harm reduction or other similar community outreach programs. And your response doesn't need to be specific to public libraries, but essentially, what are those kinds of tools that you think libraries need to be able to partner with public health?
Yeah, so first of all, just the awareness that they can reach out to like the Department of Health or public health driven agencies that are very much focused on solving social determinants. If they're not able to gain access to those systems, especially in like rural libraries, there may not be those resources available within 60 miles, 100 miles, for example. So, giving them the tools to conduct a health needs scan using publicly available data, learning how to develop a program from an implementation science lens, develop a logic model, for example, so that they can see the flow from that maps their resources all the way through the impact. And because, as I'm sure you know, it's not enough to just measure outputs or outcomes. You really demonstrate your value, especially to funders, if you're needing to justify funding, by showing all of the impact along the way. And that impact doesn't just include those 10-year outcomes, it also includes those outputs. So, really equipping public librarians, especially, with the tools that we use in public health all the time and sort of just stripping them down with to a little bit more simplicity so they are usable without requiring, years of coursework or even months of coursework to get familiar with some of those tools.
Yeah, totally. And I think your background is mostly in academic libraries. So, what does work look like in an academic setting versus the public library setting?
It's a good question. So I worked in a public library just part-time for a year after I finished library school. I worked in an academic library for 3 years. I was working at Dartmouth College, and I was immersed in the public health program in the medical school, and I worked at the hospital, which was a wonderful experience. And I loved working with all the disparate populations, including the patients. I loved when patients would come in and ask me about to help break down like their treatment pathway or their options. But I've also worked in corporate libraries. So I've been working in the corporate library space for several years now. I can't do the math right now. But most recently, I've been working on the research side and less as a librarian, but still wearing that library hat. So the distinction between the disparate settings is, first of all, in an academic library, your focus is very different. Your focus is on providing education rather than merely providing access. And I use access very loosely, knowing that access spans many things other than simply the word access. But in the academic setting, I was embedded in a course on systematic review. So, really teaching students how to create robust search strategies because as I'm sure you're familiar, if you don't have a good search for your systematic review, your whole systematic review falls apart and the validity is compromised. And I was also working with medical students, helping them to understand the literature so that they were choosing the literature that made the most sense to their patient population. I'd also work with clinicians who would come in, um, sometimes for their research projects. Sometimes they'd say, I have a patient coming in 2 hours. They have a question about this specific medication. It hasn't been tested in this population to my knowledge. Help me figure something out. Or I have a patient with ulcers, and they're insisting that we apply lavender oil. Please help me out here. And then in the corporate space, it's very different. So you have a lot less freedom to do research for the sake of doing research. Everything is mission driven. Um, And I think there are pros and cons to working in either space. I think my favorite library job thus far was probably in the academic space because you did have access to very different populations, and you were just able to impact patient care by interacting with the patient, by interacting with the public health world, with the clinicians, and with the medical students.
Yeah, that's really interesting. And I know a sentiment I've seen both with public library workers and I think also academic library workers recently is that they already kind of have a lot on their plate. But at the same time, I think we're both on the same page about the role that libraries sort of play in their communities. So how can we sort of balance those competing needs between like workload and burnout versus fulfilling those community needs?
It's a good question. So I haven't worked in the public library space for a while, but I feel like I still have some awareness of what is happening in those spaces. Public librarians, as you know, they are being increasingly asked to do more and more. You touched on this previously. They're involved in harm reduction, and that's not something most librarians signed up for. And it does come at a cost, especially if, you started your career 20, 30 years ago and the career looked very different. You weren't having to constantly justify the existence of your library. And now, with funding being compromised across the spectrum, you do have to prove that value even more. So, there was a lot of burnout. I think one of the ways that we can help librarians as public health professionals is give them the tools so that when they implement and evaluate their programs, it's less stressful for them. And when they do request from their library director, for example, a little bit of funding for a new program, we can give them the tools to make that request much easier. They can say, hey, I did a quick needs scan. It took me 2 hours when the reference desk was slow. I think this is a great approach. I did a resource inventory of what's available in our community. This is the gap, and this is how we're going to measure it. And it sounds like a lot, but I've created some tools that I think do help with that so that someone doesn't walk into the space feeling completely overwhelmed and doesn't know where to start. So, an example is introducing librarians to the logic model. It's a very simple tool, but I think it's probably one of the most powerful tools that libraries can use when they're trying to implement programs and really map out that entire process from resource collection to hopeful potential impact down the line.
Yeah, that's really helpful to think about. And then in general, what do you think people need to do to support public health or support libraries or both of them together?
So, to support your library, get a library card. That is one of the most salient ways that libraries are able to measure community engagement. Even if you don't use your library card that often, just having it is very helpful to the library. And there are a lot of resources that libraries offer, other than just going in and checking out books. So I love audiobooks. I get almost all of my audiobooks from the public library. As far as supporting public health, I mean, public health needs as much support as it can get right now. I think people just need to listen to what public health workers are saying, keep their ears open and their eyes open as to the current public health landscape. And even individual factors are influencing public health, as you know. And I think to change public health, I don't think it makes a lot of sense for people like the common everyday person who's not engaged in public health to lecture people who are making decisions that don't align with the goals of public health. So, a vaccination, for example, as a public health worker, I'm sure you know, it doesn't make that's not the best way to reach somebody. You want to listen and engage and hear different perspectives, and I think there are a lot of people who are well-meaning and they want to change someone's mind so that their child doesn't get sick from measles, for example, or infect their own child. But the approach is not likely to resonate. So, I guess just to recap, get a library card, use your library for whatever resources that make sense to you, and listen to what people are saying and try to hear them out and point them in directions of resources that are likely to resonate. No one wants to feel judged for their decisions. And a lot of people, when they make their decisions, they think they're doing the best they can for themselves. And it doesn't make sense to judge someone when they think they're doing the right thing, especially for their child.
Yeah, for sure. I think changing how we communicate is super important.
Really grateful for the opportunity to raise more awareness about the critical role of especially public libraries. As I mentioned, they are serving some of the hardest to reach populations. And the members of those populations who are coming into the library really trust the library and the librarians who serve them. So, leveraging librarians for public health work, I think, is a real opportunity to engage people.
Thank you again to Heather for joining me. I hope you all enjoyed that conversation. Let me know in the comments what part you found most interesting, and I will see you all tomorrow.